Live.
Well, hello everyone. Glad to be here for our first podcast, and hopefully this will be something that we'll do regularly. And we want to bring forward topics that I think everyone will be interested in. So first of all, some introductions. We have Lisa Kadim here.
Good morning.
Lisa is the administrator at Catholic Memorial Home in Fall River, Massachusetts. And I'm Chris Jonkis. I am a physician and internist. I have an interest in hospice, palliative care, long-term care, basically nursing home care. And then we have Nancy.
Hi, I'm Nancy Medeiros. I'm an improvement specialist and a nurse. So back to Chris.
Great. So what we wanted to do today, we realized that probably there are a lot of people out there who really have no idea currently what's going on in nursing homes. So we wanted to talk a little bit about that. And nursing homes have been pretty much closed off to the public now for a number of months. So we thought it would be interesting to bring Lisa along and have her discuss what's going on at Catholic Memorial. Catholic Memorial has a special place in my heart because I've been the medical director there now for 22 years. And we've been really fortunate in that we've been able to get through so far this COVID crisis really unscathed, with a lot of work and a lot of effort, but we've had 0 COVID cases. So, we'll talk a little bit about what we've done over at Catholic and what's going on in the nursing homes in general. So, and if there are any questions that any of you have, please post them on the Facebook page, and we'll respond to them as we can. So first of all, it seems like it's been so long now, but it really wasn't that long ago that this whole COVID crisis exploded. And I remember being at work, and it was from one day to the next, it just changed so rapidly.
Yeah, it really did. In the very beginning, which the date will be embedded in my head forever, which was March the 12th, is when we first got the news that, it was close to home, that people were getting tested, they were positive. We had to move from one day to the next we had restricted visitation, we had limited visitation, literally on one day from 4 p.m. to 7 p.m. And then the very next day, we were told we needed to restrict it. So that was very, very difficult to get back out. We have I have over 400 employees, 272 residents and families that we needed to get this information out to really quickly. When we first started getting the information out to families, we were doing it via the mail, which, as you can imagine, was not only costly, but very time consuming. So quickly we got on board with a robocall. So I am able to tape a message and send it either to families or to just staff or to both. And I do that weekly now. So every single week we have a robocall that goes out stating what's going on in the building, because the families don't know what's going on in the building.
So just to back up a little bit,
Sure.
The Catholic Memorial is one of the largest nursing homes too locally. So
And
how
in the
many
state.
how many employees do
Over
you
400
have?
employees.
And then how many residents do you have?
272 when we're full.
Oh my God! So when COVID kind of first started coming around, what was the discussion like? Let us in, inside to the discussion a little bit. Before the hard stops happened and everything went crazy.
It was kind of it's out there.
Yeah.
It's not here. It's out there.
Right.
But I think because we're so linked to the CDC, the Department of Public Health, which regulates us, CMS, the federal government, we were getting 3 and 4 updates via email daily. So we got nervous right away. I will tell you, I got nervous right away because it's so big, and all we kept hearing was it's spreading quickly, it's spreading quickly, it's spreading quickly.
Because what we haven't really said yet is you've had 0 cases.
That's correct.
So that's
Yeah, we're not going to wood. Is this really
that's
wood?
huge.
Yeah.
It might be a laminate.
So right,
You
we've
guitar,
It's a
knock on your
laminate, but it's
guitar,
okay.
Chris.
We can
We've
still
had
laugh.
0 cases of residents, and all told, since March the 30th, we've had only 9 staff members who have tested positive.
That's great.
Yeah.
That's great.
A
So
lot
now,
of hard work, but we've been fortunate too.
so going back when you were going to impose all these restrictions, what was that discussion? And how do you make that determination?
Yeah, that was tough.
Because
We
at
talked
then,
about that.
not everyone was doing that. Not everyone was where you were. So
Yeah.
that's a tough trigger to pull.
I think that there was a lot of we talked about it a lot, and administration and the director of nursing, and we had conversations about it. We were all really on board because our priority was we really wanted to protect the residents, and we knew that there would be people who would find this difficult, residents of course, and also family members, but primarily what we wanted to do was protect the residents, save their lives, and we knew that it needed to be done, as difficult as it was. I was in a fortunate position in that I am involved very much with a society called the Greater New England Society for Post-Acute and Long-Term Care. I'm the president of that organization, which is part of a bigger organization called the American Medical Directors Association. Basically, we are a group of doctors and nurse practitioners and physician's assistants that are involved with nursing home care. And I had been on a lot of conference calls throughout the country and the region in regards to what was going on. And there was a lot of information out there that wasn't even really as much in the news at that point. And I really had this sense, and Lisa knew this also from her connections, that this was really exploding out there. And then if you remember out in Western Mass at there was a home out there where they had, within a week they had, a huge number of cases
I
and
remember
deaths.
that, yeah.
I think it was the Soldiers' Home, if I
Yes,
remember correctly.
Yeah.
So, we were we really wanted to get on board with this quickly. I remember one day I was rounding in the nursing home, and this was before we closed it off. And I don't know if you know this, but I went around to my residents that I was seeing that day, and I asked them, what would you think if we did this? Because I wanted to know what their opinion would be. And, all of them basically said the same thing. They said, if it's going to save lives and prevent people from getting sick, then we understand it'll be hard, but we'll do it. I didn't have one resident who was against it. Clearly, many of them expressed that it would be difficult.
Right.
And I don't know if they really understood how long this would go on.
Right. I think
and that's a whole different
the key
story.
Piece. Yes. Yes.
But they understood that it needed to be done.
Yeah. So we did things. And it was daily. It was Chris calling me at night, like, we're not letting volunteers in, right? Like those kind of, okay, the next morning we have to stop this, we have to stop this. It was locking all the doors of the building, literally, sealing ourselves in. We only have one entrance, and that continues. And there is someone there who screens. And screening is temperature, probably everything that people usually get when they go to the doctor's office now. Temperature and questions of, do you feel sick today? Do you have a headache? Do you have a sore throat? Is there anything a little odd? Have you been with someone who has COVID? Have you been in another building with COVID? Because that comes into play with some of our staff who have more than one job.
Yeah.
The lab techs who are going facility to facility, all of those kind of things. Hospice. Do we stop hospice from coming in?
So did you stop hospice?
We did.
Yeah, we did.
We stopped hospice. We have a palliative care program at Catholic Memorial Home, so we already had things in place. We certainly could talk to the hospice nurse if we needed to, but we just felt that we could care for the person. We have a chaplain and a director of spiritual care in our building all the time, so I felt like their spiritual needs could be met that way. We have 4 social workers, so I felt like that was okay.
Right.
That we could take care of them just because those wonderful hospice nurses and aides go to a lot of different places, including people's homes.
Right.
That scared me a lot. So it was kind of like about locking people out, which did not go over well, as you can imagine. We have wonderful families that I will say 98% of the families that I have are grateful, are eternally grateful, and continue to tell me, thank you for keeping my mom safe. But we're going on a lot of months now, and not seeing, not touching is very difficult for them. And I it was a stop masses. We don't have church anymore. We had daily mass. So now what we do is our chaplain comes in, does a mass, and it's videoed so that the residents can watch it in their rooms. But it's no communion, no Holy Communion. That's very difficult for that age group.
So with a lot of the initial conversations, like you were saying, you were talking to the residents and things like that. Like, did they get the full impact of the restrictions, do you think? And how did that conversation continue with them?
It continues. So when it first started, we quickly got our resident council together because we knew that would be the last time that we could get them together because we can't have groups of more than 10.
So what's the resident council?
Resident council are any resident in the building. They meet once a month. Talk about any concerns that they might have. I get invited to it. I have to be invited because it's their meeting, and answer any questions they might have of me. So we pulled that together really quickly because we knew we can't do this anymore.
Right.
So at this point now, how they find out is the residents who are able and understand. When I do that robocall I talked about, when I do the family one, I have it printed, and my social workers hand it to those residents so they know what's going on.
Every nursing home has a resident council, basically, and they elect a president, and they can be very heated elections, let me tell you.
Yeah.
So, they really can.
Very true.
But they're very involved with what goes on in the home, so they bring any concerns forward that they have or the residents have. So it's really an important piece. It gives them some control over what goes on.
So now you're putting all these pieces together. You said March 12th will be a date that's forever branded in your head, right? You're putting all these pieces together, and you're creating this program to keep everyone safe. Like, talk about that, how you put all those various different pieces together. And did you think of everything all at once? Like, what was like the one thing that, like a couple of things that you were like, oh gosh, we didn't think of that?
Well, hairdresser.
Oh my God,
Wow, yeah, these people's hairs, we try very hard. And so things like hairdresser, it would trickle in. It would trickle in, like somebody would come in like, oh yeah, we forgot about, the x-ray tech. How about the dentist? Do we let the dentist in? I'd be like, oh wait, let me think about this.
So what happened with the dentist? What are dentists doing now? Are most dentist offices open? I'm not sure.
I don't know.
Some dentist offices are open. We have a dentist that comes right into the nursing home. He has basically a room, equipment, just like any other dentist would have. So instead of sending the residents out, they can get dental care there.
And we've always had that.
Right.
So what we did with that was emergencies. I certainly wouldn't want anybody in pain just to keep them safe. So it was emergency issues, that type of thing. If someone's dentures broke, we literally would meet the dentist at the door. Like, we did a lot of that. We did we continue to do a lot of our business office. They'll go out to someone's car to have them sign something.
Yeah, you have to really think outside the box with a lot of this stuff. And you can't think of it all, you can't figure it all out at once. Yeah. It's not as if that day occurred and we had a full plan for everything. We had the big pieces in place, but then things would come up that we hadn't really thought about. You can't think of all these things, and then we'd have to react.
And it still is happening.
Yeah.
So with PPE, which is personal protective equipment.
Yeah, let's talk about that.
Gowns, gloves, masks, eye shields, face shields. It changed, honestly, weekly, what the government told us to do. So we would educate all of this staff with, you need to wear masks, you need to do this, and then literally 2 days later it was like, oh my gosh, we have to change again. We have to re-educate all the staff. And then getting the PPE into our building.
Like?
That continues to be a nightmare.
Still.
Yeah.
Continues to be a nightmare.
It's difficult.
It's very difficult. Unfortunately, I think that when this all hit the United States, they thought of hospitals, which rightly so. They thought of hospitals. They thought of, ventilators, how many ICU beds. Everyone was very intrigued in that. And the high population that we all said was going to get hit, we're left with, okay, how about us? What are we doing? Wearing masks weeks and weeks at a time until they're visibly dirty because we don't have enough.
Right.
Who really has to wear it? Who doesn't? And then we thought.
And are you on your own through all this, or are
not
you
really? We are in, again, Department of Public Health.
Yes.
I can request things. We have lots of people have come forward with cloth masks. Lots and lots of wonderful, wonderful people have volunteered. And then we got at least like 200, 300 cloth masks. We were so excited. And then the next day they said, can't use cloth masks in the building.
Right.
Okay. So we give our cloth masks to our residents who also need to wear a mask when they leave their room. That's a whole nother difficult
issue. And that's difficult, especially with the dementia patients, as you can understand, because they don't really comprehend that they need to have a mask on, and they have difficulty leaving it on, and they're continually taking it off. So there are challenges, particularly challenges with the dementia unit. But
Absolutely.
you know, the PPE issue, you know, it's actually still continues to be a problem out there. You know, I'll just step aside from the nursing home world and go to my personal office, because I'm in a lot of different spaces where I work. I mean, we closed down for 6-7 weeks, not because we didn't want to take care of patients, but we had no way to really protect ourselves. We had no gear.
Right.
So finally, we started to get some N95 masks and whatnot, but we're using them in a way they're not supposed to be used. This is an N95. It's an odd-looking N95, but it's an N95 all the same. These things are supposed to be used for one interaction, basically. You know, I've had this one for 2 weeks now, and I'll wear this till it basically fails.
Right.
And in the office, I do the same thing. You know, and it's a little scary because you question how much protection you have, but it's all we can do. And it's amazing to me that this far into this pandemic, that we don't have a plan, a federal plan to just get more of this stuff out there. I mean, it's out there, but it's not enough. I mean, we should be not using PPE until it fails, basically. We should be able to use it the way it's supposed to be
As
used.
it was originally intended.
Right.
Yeah.
But, you know, of course, this goes back to many, many years of limited manufacture in this country, and a lot of this stuff is not made in the country itself. And, you know, this is a whole other podcast we could do,
Yeah.
talking
A whole
about
supply
the
chain
politics
podcast.
and the economics,
Right.
and I'm not sure we want to
Right.
get into that here, but it's definitely not where it needs to be right now.
So what are people thinking? Like, everyone's been targeting like the fall for a resurgence, and now we're seeing what's happening in Florida and Texas. Like, does that affect some of your decisions right now too, like in the nursing home, as you continue to make?
When we continue to hear on our webinars, you know, the next phase, so it scares me. I hear things like it's not if you get a resident who's positive, it's when, and it's like, oh gosh. So we always have to be prepared. Right now, again, luckily, so our residents, if they have to leave the building, so for a very long time, it was absolutely no doctor's offices, just the hospital. If they left the building because they had to go to the hospital, on return, they have to be quarantined for 14 days in a room, usually not theirs, has to be a private room. For 14 days, they can't come out.
And that's a big deal for a resident.
It's a real big deal for
That's a
a
big
good
deal.
amount of residents,
Yeah.
especially the ones who are our long-term care residents who have fixed up home
Right.
in their room,
Right.
and now we're moving
Right.
them.
Right.
Right, because this is their home. You know,
Right.
just as you go home at night to your house, this is their home, and all their belongings are there. Everything that they recognize as being theirs is there. So now we're moving them to another room where they're going to be, and they're not going to have all their things there,
Right.
of course, and they're not going to be around other residents that they know. They're really isolated for 14 days, and that's just because they go for a doctor's visit. So, you know, there are things I've done as a physician to try to limit that necessity with patients. For example, if someone has surgery and they have some staples that need to be removed, you know, the norm was that they would, you know, they go for a post-op check, and not just for the staple removal, but for a post-op check, and they go to the surgeon and he'd look over everything, and 99.99% of the time everything was fine, and they'd come back. But now, you know, we're trying to do this stuff in the home, and we're telling the surgeons, you know, we're not going to send them out unless, you know, we have a conversation with you. So if you feel this person needs to go out, you need to contact me as the medical director, and I need to discuss it, because they're going to come back and be in isolation for 14 days. And there's an emotional toll that takes on the resident.
Absolutely.
So I want to get back to a little bit. You were saying that messaging has like really changed a lot, and sometimes it would change probably day to day, I would imagine, depending on what was coming out, new standards with the CDC. What were those communication pathways like? Like, I kind of want to get to other organizations that are listening right now to the podcast. Like, it seems you had an effective way to communicate.
I think that,
What did you set up?
Catholic Memorial Home is part of 5 nursing homes that are owned and run by the Diocese of Fall River.
Okay.
So the administrators of each home, the directors of nursing of each home, our CEO and senior management team speak daily.
Okay.
Every single morning we speak. So that helps a lot, because sometimes, you know, one of us might have missed something.
Right.
The other one doesn't. They're the ones who are quickly typing out those new policies to get out to us.
It must have been a full-time job.
So it is a full-time job, and it still is, because, yeah. So I think that I believe that has helped a lot. And just constantly, it's almost daily, the webinars and the conference calls with CMS, CDC. It still is a lot of that. And some of it is information that, okay, we already know that kind of stuff.
Right.
But some of it is new information. I get emails up to 8, 9, 10 o'clock at night from those kind of situations of, like, starting tomorrow, we now have to do this. One of them was, so we knew for a long time that anyone entering the building who is allowed to enter the building, so mostly staff, had to wear a mask every minute they're in the building, unless they're eating. They have to eat 6 feet apart from each other. Not in a crowded room, so we had to look at that. Where else can my staff eat? Because this started in the inclement weather. It was still cold in March and April, so where else can they eat? And it was a face shield when we first started. Then it changed, thank goodness, because those can be very hot, for regular population, we could wear goggles. Eye protection of some sort, and eyeglasses are not good enough.
What's regular population?
Nobody has COVID.
Okay.
Sorry. Non-COVID, negative residents. And then suddenly it was, so if you leave the building for anything, you cannot leave the building with the same PPE. So then we had to find a place for 400 employees, PPE, so when they walked in the building, they could wear the one that they had, let's say, in their car, but then they would get screened, and then they had to immediately go to this place where they could switch it out, and then same for leaving, they have to switch it. So it's these kind of huge things that we have to encounter.
How does all of that get, like, communicated to a nurse's aide? Like,
So we do, it's constant education, and it's a lot of education. Our director of nursing did a lot of education as they walked in the door. So if there's a good thing of having one entrance and exit to the building, that's it.
That's it.
Because you're catching them right there. You're catching them right there. You're going over it. You're demonstrating it right there.
Yeah.
So that was
As
kind
they
of like your
literally
daily
walk
huddle
in.
almost, like
Well,
as they're walking through the door?
We have a morning report, which is basically a meeting that we have
And that's with all
every
the
day.
staff?
It's not with all the staff, no, but it's with the director of nursing, administrator, myself. It's with management, basically. And then it can filter out from there.
So then management takes the messaging to the staff. I'm just thinking for, like, anyone listening, like, what were those, because you've been successful.
And I think
so what
that
were those pathways that you set up?
Robocalls. Right now, that is and I can do it I've done it more than once a week. To get to every single staff member, it has to be a call.
So what's that typical robocall like? What are you saying?
So I talk about, again, how lucky and blessed Catholic Memorial Home is.
Yeah.
I always start with that. Thank my staff as much as I possibly can. And then say what's going on, what's new for the week, what's new coming up. We'll probably talk about testing in a little bit. I talk about that kind of stuff. And always, I try very much to always end with, again, thank you so much. Please stay safe.
Yeah.
So before the 4th of July,
Oh my
yeah,
gosh,
so my robocall before the 4th of July weekend was a lot about them and what they do outside of my building.
Yeah,
Because that's what brings it in.
What's
exactly.
been your biggest challenge with the staff?
Yeah. Well, can I just mention?
Especially now
Yeah.
because things are relaxing a little bit. Like, everyone feels like, oh, we're in Massachusetts.
Right.
We're not struggling like
we
some
haven't
other
relaxed
states.
at the nursing home, and so this is something I'll just mention is the greatest part of our success beyond the fact that management has thought of what to do and developed a plan, is we have really amazing nurses, CNAs, our environmental services, the people who clean the home. All of that is really, if we didn't have that, if people didn't follow the guidelines as far as how they don their PPE, how they take it off, how they go into rooms, how they interact, how they clean the facility, we wouldn't be, we would probably be in a different situation. So we have really amazing staff. They've done a great job. And Lisa's very good about, letting them know that, and we try to let them know that. Because one of the things I really worry about when we hear about a second wave, and that is this level of exhaustion that can occur with people both physically, emotionally, because it's very difficult to have your guard up 100% all of the time, and we have to do that. If we don't do that, we let it down for 1 second, we can have a problem.
And you said very quickly, I think my staff, like it was just so natural and normal
Right.
for you, but there are, some people that doesn't come
Right.
natural or
Yeah.
normal
and,
to.
and you really need to because
Yeah.
of that. Just what we're exhausted. I'm exhausted.
Yeah.
Everyone's exhausted. You hear all the time, right? Can't wait till
Yeah.
this is over. And I think, don't know that that's going to happen. I think it's, again, everybody talks about the new norm, and it needs to be the new norm, and
Right.
we need to just be okay with it. But it is constant vigilance of put your mask up,
Yeah.
put your mask up. Don't
Yeah.
forget your mask, put your mask up.
And I talked to other medical directors in some of these homes. They're doing a great job, and they still end up with a lot of COVID in their homes. So,
Sure.
if we end up with it, it's not because someone did something wrong.
Right.
But on the other hand, we want to make sure that we're as vigilant as possible to reduce that risk. And it's very, as Lisa mentioned, it's very tiring to the staff. But they're doing a great job.
So I just want to circle back again to leadership and how they're communicating with staff. So Chris and I talk about sometimes the acronyms that are out there for leaders to help them communicate, or just to help them really verbalize that their employees are valued, right? So one of the acronyms we talked about was AIR. When you say thank you, it should be like the air you breathe, and AIR would stand for acknowledge, inspire, and recognize. And it's just something that, I think as leaders, it's free and it's easy
Yeah.
to do, and you can do it in a heartbeat.
But you're right, it needs to come naturally. It
Yeah.
needs to, and for me, it started a very long time ago when I started my first nursing job and working with someone who I would leave, and that head nurse would say thank you, and I would think, thank you?
Yeah.
For what? I just came and did my job.
Right.
And they're like, no, because you came and did your job, and thank you. And so that stuck with me for
Right.
like over 35 years. And I try very hard to do it all the time.
Yeah.
I think that all of my staff, all of my department heads do that. All of my management staff try to do that.
I think words are really important,
It's just,
too.
just little thank yous,
Yeah.
just little tiny. We try to do things to thank them. Again, it's hard because of social distancing. So we have like pizza. We've had different food trucks come.
Right.
Anything that ice cream sundaes, anything that we can
pizza.
do in between.
Those little things matter.
I think so. And gosh, even when you tell me I do a good job, which you do sometimes, it's like, oh, it means something.
Right.
You had a
Yeah.
great story once you told me when you were
Oh.
back in the hospital.
Yeah.
I don't know if you want to share that, but I thought it was such a great story.
Well, just quickly, I used to be a manager in one of our community hospitals. And we always used to celebrate, of course, the Nurses Week, and we used to think of what we could do and give them to show appreciation. And, that was kind of a big deal. There was a lot of planning that went into that whole Nurses Week thing. Well, one of the things I used to do was just to write them, the staff, just, everything they did right for the year, and just like recognize like all our accomplishments and everything. And I used to also do that on a very personal level. So if one of the nurses did something, I would just write her a little email. I heard from this family member. It was really
Nice.
important. Thank you for doing this. And years later, one of the nurses said, thank you for the pen for Nurses Week. But she goes, what really mattered to me? And she opened up her locker, and in her locker was an email I had sent her like 5 years ago. She goes, I always look at this. I posted it in my locker. Every time we open up my locker, it just it means something to me.
Like,
And we
wow.
forget how important as leaders our words mean, and what they, they can really lift someone.
And to acknowledge that we know that this is hard.
Yeah.
We know that this is hard. I know
Sure.
that this is hard.
Yeah.
It's very hard, and it's just stuff we have to do. At Catholic, I feel like they, at least right up to now, they see that there was something positive, that
Yeah.
my residents are healthy.
Yeah.
Right.
So they at least have that.
Yeah.
Yeah.
What was the key thing that you think you did? You think it was just that communication and getting together every morning and having that game plan and putting it into place?
People ask me this all the time.
Well, I guess like if you had to
What are
go
you do-
back,
what
if
are
you
you
had a
doing?
chance
Yeah,
to do
what are
it
you
all
doing
over
different?
again, like what, like what,
I don't know that
what
I would
could
do
you
anything
say that, this really worked well and
I
God
think
just,
it's going to be communication in all aspects. in the communication of myself and my department heads of constantly talking about it, constantly talking to Chris, constant, and then when do we get it out to the staff?
Right.
When do we need to get it out to the staff?
Right.
And then all of us reinforcing it.
And being on the same page.
All of us.
I think
Yeah.
everyone's on the same page.
Yeah.
And I think we were really quick to lock down the home too.
Mhm.
I think that made a difference. I mean, there were other homes that were they were slower to do it, and I think we were all on board with that. It was a hard thing for homes to do that, as we discussed. And I remember one of my nurse practitioners who goes out to another home in the area. This was kind of in the early stages of COVID. She was very concerned, rightly so, and she would come in with an N95 mask on, and it was before the time that really people weren't routinely wearing masks yet. And she was asked to leave one of the nursing homes because they felt it would look bad to the residents and the family members, and it would make them unduly anxious. So I didn't have to struggle. We didn't have to struggle with that. I mean, when Lisa said this is what we have to do, everyone was on board. We didn't have this person saying, oh, that's not going to be good. How's it going to look to residents or to families? No, everyone was on board, and I think that helped out. There was no division there.
So what's next? Like, what are you looking at now? And
Slowly letting a little bit more of outsiders in.
Yeah.
Not visitors yet. I will say though, if a resident is at the end of life stage, we
that's
do
important to
allow
mention.
family members in. We have guidelines for that. We have screening restrictions, who can come, how long they can come, that type of thing. But I have always allowed that. I never stopped that.
Right.
So now the governor said, so right in the beginning, our visits were FaceTime. So our activities department, as you can imagine, is running the building, doing FaceTimes, and we have front door visits. So we're lucky enough to have a glass front door.
nice.
So it's locked, so I know it's safe. And then the family member comes at a certain time. We have the resident come down, and then they phone in. So the residents get a phone so they can see them and talk to them, and it's a safe thing.
Very nice.
That was going fine, and the governor said, "Okay, we're going to do outdoor visits." So I got nervous.
Mm-hmm.
Every step I get nervous.
Of course.
I got nervous, and then but we set it up. We have a courtyard, and it has a gate.
Yeah.
So we've utilized that. We have,
Nice.
a table in front, and then the resident, we actually mark off where 6 feet is.
Mhm.
The resident's family have to be screened. They have to wear a mask. The resident has to wear a mask. And it's going wonderfully, but it goes so wonderfully that it's overwhelming. Again,
Yeah.
270
Right.
people, every family member, and it's not just one family member.
Right.
Every family member wants to finally gets to
Right,
see their loved
right.
one, and we are getting crazy overwhelmed. So we don't just have activities now doing that. Activities sets it up, but all of us join in. We'll pass it around and say who can do a visits today with this person, because that really has blossomed. So what's next is probably just waiting for the governor. And that's what I tell families, because they're like, when are we going to be able to come in? And I can't do anything like that without the governor's,
Right.
push.
What's the current policy for testing employees? Do you test employees?
Mhm.
Okay, so we started.
Okay.
I know.
Yeah,
You
this
can
is,
tell, right?
This is an interesting topic.
Okay, so we started testing employees on April the 30th. Every
Okay.
single employee in our building was tested on April the 30th, as well as every single resident. That was a baseline. So we needed to get a baseline. We were told we needed a baseline. So from that was every resident was negative. I think from that, only about 3 of our staff members were positive. What happens when they're positive is they need to stay home.
And they were asymptomatic.
They were
obviously.
asymptomatic.
Mhm.
Yeah.
They need to stay home for 14 days. They need to call their physician, and then they kind of go from there. And that would be the same for screening. I know I'm jumping back a little bit, but when you're screened, if they do have a temperature, or they say yes to any of those questions, they're not allowed in the building. We ask them to go home, to call their physician, and to let us know what's going on. So we did all of that testing. Then in between that time and current time, we tested residents who are symptomatic. So any resident who is symptomatic was tested, or if a staff member was positive and they were in contact with that resident was also tested.
How long is it taking for you to get results back?
That's a whole other issue, right?
Is that like, are you coming back to the next podcast?
Yeah. So initially it was just a couple of days, I would say initially. Yeah. So now, again, the governor of Massachusetts has said, okay, and unfortunately this was said on, I want to say like June 30th, that from July 1st to July 19th, we had to do another baseline. And again, in my building, 400 people. Yeah. So we just finished, and I am proud to say that all of my staff were tested, but now the results are trickling. Yeah. And this is what I noticed was in the news this morning. Yeah. I know Rhode Island Homes, it sounded like they had 6 people that felt great, were tested like they should have been tested, and then it came back positive a week later. So for that whole week, they were positive.
I think the problem is if you go to test one particular resident, you can get that result back fairly quickly. When you're testing hundreds and hundreds of people, it overwhelms the entire system.
Sure. And then everyone's doing it at the same time.
The infrastructure isn't there to support that. Right. So these tests come back at a much slower rate than they need to come back at.
So the only thing I can say to that, to families who are like, what? Is that don't forget my staff is still wearing their PPE. So positive or negative, they're still wearing gowns, gloves when they care for someone. Everyone in the building has a mask. Everyone in the building has eye shields all the time when they're on a clinical unit. So that part has continued. If someone is positive and asymptomatic, there's not a lot. You can't test every day.
No.
Well, and I think, and we've talked about this before, and it's kind of bizarre, but my husband's an ER nurse too. And I think, both of us as nurses feel more protected when we're wearing all the PPE than whether we go into to do grocery shopping or something. That's what freaks us out.
Oh, I feel much safer at work. Yeah. Much safer at Catholic Memorial.
And everyone's like, oh my God. And it's like, no, really.
Very safe.
I'm challenged when I walk into a store, more so than anything.
I haven't actually been in a store in 4 or 5 months now. We do curbside pickup. I don't even bother going in.
It's scary. Awesome. It's scary what's out there.
It frightens me because I know there are people out there who aren't doing what they're supposed to do. So, I try to protect myself and my family as much as I can. So we do what we need to do. We have a question from Richard. So why is there so little testing after 4 months testing and still not readily and easily available? And this goes a lot with what we were just saying, but it's such a complicated societal issue. I think, as we've mentioned, this really unfolded very quickly. And I don't think the infrastructure was there in our society to really support this. We haven't really manufactured in this society as we need to manufacture for greater than 20 years. Our society is based on, basically, it's mostly a service-oriented society. We don't have a lot of manufacturing, and most of the stuff that is manufactured, PPE, I'm sure even test kits, the machines that, produce the test or do the test, they're probably produced in other countries. I know the PPE at least is. So I think it was a lack of infrastructure, but it goes beyond that. It goes back to, what have we done in this country for the last 20 years? Are we really manufacturing? Are we geared up to manufacture? You look at World War II, when that occurred, how the whole country was able to mobilize and in short order really produce what needed to produce. Because they had the factories there, they had the ability to do that. We just don't have that now. So that's a bigger problem. That's a problem that comes down to there needs to be a larger federal response to the way we do business in this country. Right. So that gets into politics, which I'm not sure we want to get into, but that's my answer to that. I don't know if you have a different answer to that, Lisa or Nancy.
No, I think I support that. I mean, I think we realized a little too late that our supply chain was outsourced, and then we had that difficulty just acquiring the simple supplies that it takes to get that testing back. And then without clear direction mandated at a national level, we struggle.
I mean, you look at where we're really at risk in this country. I mean, one of the major risks we have, and I don't want to go too far astray, but because we rely on other countries so much for a lot of the things that we really need, it really put us into a predicament. No one could have really thought that this would happen, that we'd have a pandemic, of course, but we probably need to be more self-sufficient going forward, and hopefully we'll learn from that.
That's what we've learned.
Hopefully we'll learn from that. I mean, I hope we do. It brings forward the question that I kind of threw out there a little bit earlier before we had this. Has anything good came of this?
Yeah, and I guess I'll piggyback on that too, and just like lessons learned. So
Lesson
again,
learned,
for
so.
like any organization that may be looking for new ideas or better ways to do things, what would you say?
Yeah.
I'm putting you on the spot.
Yeah, you
What would
are.
you say?
I have my
Lisa?
response, but I'll see what Lisa has to say.
No, I know my answer seems to be communication, but it's so important. It's so important.
Fundamental.
And should just be always open and say the truth, even if you don't know it. And that includes the residents and the staff, whatever, because there were times in the beginning that it was, well, maybe they're not telling us everything. And I've had family members, even though in my calls, those robocalls, say we currently have none, and they would be telling us you're lying. And I think what happened with that was, if you go on the Department of Public Health searches, Catholic Memorial Home, it says less than 10 because of the 9 staff members that we had.
Yeah.
They group it together. They don't tell you that they're grouping it together, but it's grouped together. So once I figured out, like, why are they saying that I'm lying, then I currently say, we still have, we have the original 9 that tested positive, all have returned to work. We currently have none, so hopefully, like, I would never lie about that, and we can't lie about that.
Right.
But that's all anxious. It's anxiety. It's not knowing, and again, not seeing,
Right.
and I do. It's about listening to families, no matter how difficult that can get. I think it's really important to just listen. Sometimes that's all they need. They need to vent, and then it's over.
Yeah.
Right.
I had someone yesterday who told me, I'm so sorry. And I said, no, I can't imagine what this is like. I can't imagine seeing your mom or dad every day and now done. You just lock the door and that's it.
Yeah.
That's horrible. But please know that it's the only way that we can keep them safe.
Right.
Right, and that's the ultimate goal. I think you can't say that a lot of good came out of this pandemic, really, right? I mean, people have suffered, people have died. But if I were to say, what is the one thing that maybe we've learned, and maybe it's more lessons learned rather than good, is that I think it really exposed kind of the chinks in the armor in our society and in our industry too. Mm-hmm. What are the things that going forward we can do better? And hospitals have learned from this, private practices in medicine have learned from this, nursing homes have learned from this, other sectors of industry have learned from this. We've all learned where our weaknesses are. We've learned how to adapt. That's an important thing because we've all had to adapt quite a bit. So I guess if there's anything that's come out of this that's in any way positive, it's that it's just that we've had to look at things really closely with a microscope.
Yeah, and I think what's important in that statement too is that some things did work well and maybe worked better because you had to have such a tight process in place to get the outcomes you wanted, and then moving those processes into the new normal, which is exactly in our wheelhouse. It's what we do for 27 Degrees Consulting is really look at those processes and do improvement strategies. And we're certainly available to help any organization out there who just needs a game plan to get going with that.
This is what we love to do.
Yeah.
Look at best practices and processes and tear processes apart and figure out what the best way to approach a problem is.
Yeah. Lisa, thank you so much. It was just great talking to you.
Very nice to meet you.
And hearing what you do for your residents and your staff.
Thank you.
Thank you. All right.
So should we end on a song?
You singing.
Absolutely,
All right.
Chris.
So
I'm backing up.
Me too. Come on back. This could get scary.
all right. So look.
Wait. So give us a little background on this song.
So the background on this, and I got to give a little shout out to my daughter Emma. So I've done like a little series of short 2-minute videos, and that basically, talking about how to wear a mask and how to stay safe and things such as that. And one of the times I felt it would be really interesting just to play a song. So I took a very well-known song and my daughter changed the words. And this is what I came up with. And I am not a professional musician.
Kind of, he is.
Yeah, kind of he is. He's the higher.
So, but first of all, I'm gonna this guitar. I'm gonna do a little quiz here. This is made in America, and it's a Guild. Does anyone know where Guild was made?
Rhode Island,
Missouri,
Westerly, Rhode Island,
California,
Westerly, Rhode Island. At one point, Westerly, Rhode Island. So this is actually from around this area.
And he sang. So those of you who don't know, he sang to us at Morning Report.
I did.
So this is also a way to de-stress.
I think, yeah,
having Chris Johnson
maybe
singing
that has to
us.
be something like that's done weekly.
Yeah.
You sing the new messages.
And I just want to say, singing with a
that could be
mask
bad.
is very difficult. But here we go, and I will try. And for those who have sensitive ears, I apologize.
We're the chorus. By the way.
Looking for Purell, searching for TP. All the people hoarded it all. Strumming my 6 string on my front porch swing, 6 feet away from all that I know. Wasting away again in Coronaville, searching for my N95 mask. Well, some people claim that the government's to blame, but I know it's nobody's fault. I don't know the reason I stayed here all season. Everyone's coughing, spreading this flu. It's a real bummer, COVID all summer. How it got here, I haven't a clue. Wasting away again in Coronaville, searching for my N95 mask. Well, some people claim that the government's to blame, but I know it's nobody's fault. I sneezed in my elbow, coughed out the window, had a fever of 102. There's booze in the blender, and soon it will render that frozen concoction that helps me get through. But wasting away again in Coronaville, searching for my N95 mask. But some people claim that the government's to blame, but I know it's nobody's fault. Thank you, everyone. We'll see you in a couple weeks.
You'll have to do like a reopening song for the next podcast.